Blood transfusions are an important and frequently used medical procedure in various surgical and non-surgical contexts. While transfusions are often life-saving, they have been identified as one of the most overused procedures in hospitals, with potential negative effects on patient outcomes if given when not indicated. To help clinicians optimize transfusions and prevent harmful overtransfusion, we developed Sanguine, a visual analysis tool for patient blood management, or PBM. Sanguine can help domain experts find links between transfusion and patient outcomes and review their practice related to PBM. Here we see Sanguine showing cardiac surgery data with multiple views, but let's start from the beginning. Sanguine is designed such that an expert in patient blood management can create visualizations and then share them with clinicians. Here we start with an empty view and add a heat map to compare surgeons' transfusion practices. We first subset the data to a few relevant procedures. We're picking coronary artery bypass grafting, which is a common cardiac procedure. Now we can see how frequently each surgeon performs these procedures and how many units of blood they use. We can see that the zero transfused squares are dark red across all clinicians, indicating that most bypass surgeries did not use any transfusions. The surgeon that performed the most procedures, 179 cases, did not transfuse in 80% of the cases. To bring in context, we can add information on lab values and outcomes here. We add preoperative hemoglobin values and death rate to this heat map. We can see that the death rate is relatively low for bypass procedures, but variable, ranging from 1 to 9% depending on the surgeon. We also notice that there are cases with low preoperative hemoglobin values, an indication of potentially inadequate anemia management that could be improved. If we want to investigate how outcomes correlate with transfusion practices, we can facet this chart by an outcome measure, such as the need for long-term ventilation after the surgery. For each surgeon, we have now split the rows. The first one, shown with the gray marker, shows the cases that required long-term ventilation. More than 200 cases in total required ventilation post-surgery. We can see that cases with bad outcomes also tended to require more transfusion, and that the mortality rate is higher among patients ended up with long-term ventilation. A key measure to evaluate appropriate PBM practice are pre- and post-operative hemoglobin values. We introduce a dumbbell chart to show this data. Pre-operative values are shown in green and post-operative values are blue. The green and blue horizontal lines show the median values, while the dashed line corresponds to clinical recommendations. We can facet this chart by surgeons or units transfused, among others. After removing the zero transfused cases, we can look at post-op hemoglobin values. Some of the patients ended up with much higher post-op values compared to what is recommended for a transfused patient. In other words, the post-transfusion hemoglobin target was overshot, indicating that they unnecessarily received too much blood. Finally, a detailed case view, a dot plot, and a tabular lineup view complement the options available. All views are connected through linking and brushing. We can brush the case that receive an unusual amount of transfusions in surgery. Then we can view these cases in the detail view on the right. This case did not go well, unfortunately. The patient received ECMO and died. In lineup, each case in the database is shown in this tabular format. We can apply a filter on DRG weight, a risk score. Higher risk scores indicate the patient is at higher risk. We can filter down to patients with high risk scores and view the result in the main view. We noticed that about half of these cases did not receive red blood cell transfusions. This is much lower compared to all cases. After a PBM professional has created a visual report, they can annotate the chart, share the visualization with the clinician through a URL, using a simplified view that limits interactions. We achieve this sharing functionality through comprehensive provenance tracking, which also enables undo and redo. In our paper, we show a case study of how Sanguine can be used for PBM review analysis and patients like my decision support for blood component ordering during surgery preparation. We expect to be deploying Sanguine for clinical use in the near future. Thank you for watching our video.